Welcome everyone to today's program. I am Akanksha Jayanthi with Becker's Healthcare. The program will begin with the presentation and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have and will follow up on questions they do not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after the completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to turn the floor over to Mark Layden to begin today's presentation.
Thank you, Akanksha, and good morning, everyone, or good afternoon, depending on your time zone. I want to thank you, Beckers, for hosting us for today's webinar, Beyond Compliance, How CMOs Accelerate Workflow Using Secure Texting. My name is Mark Layden. Not only am I the Chief Marketing Officer for TigerText, but I'm going to also be your moderator for today's session. Maybe a little bit about TigerText. Next slide. So TigerText is the leading provider of secure messaging solutions in the enterprise world, particularly within healthcare. TigerText has a large range of organizations, and more than 5,000 facilities in the healthcare arena are using TigerText to ensure secure, compliant communications within their environment. TigerText sends a very large volume of messages. In fact, over about 500 million messages a month to TigerText networks, as organizations are painfully aware of the importance of keeping their communications safe, secure, and compliant, and making sure that PHI in particular stays safe and doesn't fall into the wrong hands. Next slide. From an organization perspective in healthcare, we have a large number of organizations within the healthcare environment that utilize TigerText. In fact, four of the five largest healthcare facilities in the United States, and the acute care, as well as in hospice, home care, as well as private practice and specialty groups, including such notable names as Ventura County Medical Center, which we're very lucky to have on this call today. So the reason organizations in healthcare have moved to TigerText because we're really a pioneer in helping healthcare entities understand the complexities of how to communicate securely and the importance of making sure that they use a compliant solution when communicating, both for the security as well as the improvements in workflow and productivity that happen when people are able to communicate quickly. It only leads to better outcomes, faster patient care, and basically a better environment within the healthcare organization. Next slide. So on today's presentation, we're going to be talking about compliance, and Dr. Wong is going to be talking about how CMOs, or Chief Medical Officers, as opposed to what I am, a Chief Marketing Officer, accelerate workflows using secure texting. Dr. Wong is going to talk about how clinicians use secure messaging to send PHI in a HIPAA-compliant fashion, and how that helps to both accelerate delivery of critical information, how and what different ways it enhances patient care as well as the diagnostic process, and last and certainly not least, how secure texting within a healthcare facility can help improve collaboration within the care team and improve the reliability of communications and ensure that you have the best possible outcomes. Next slide. At this point, I want to go ahead and introduce our speaker. We're very lucky to have Dr. Brian Wong from Ventura County Medical Center in Ventura, California, where he's the Chief Medical Officer. Dr. Wong received a medical degree from Northwestern University, the Feinberg School of Medicine. VCMC, as Ventura County Medical Center is known, is a fully integrated, comprehensive system of hospital, ambulatory care, and behavioral health sciences. In fact, VCMC was ranked #1 in family medicine residency by U.S. News and World Report, as well as Doximity in 2014. And we're very, very lucky to have Dr. Wong on today's presentation. At this point, I'm going to go ahead and turn it over to Dr. Wong.
Thank you very much, Mark. I appreciate your introduction and appreciate the opportunity to be here and join everyone on this call. So I wanted to just first start out by describing how we first even launched off into HIPAA-compliant texting. Roughly 2 years ago, we noticed that there was a significant risk, particularly surrounding our physicians, our clinicians, who we knew were communicating with each other through their mobile devices, primarily their cell phones. They were texting, frequently using their mobile devices to communicate information regarding patients that they were caring for in our hospital. We recognize this as a risk just given the way that traditional texting through mobile platforms is really not a secure method, and we wondered if there was a better way to go about doing so. And we explored the possibility of partnering with a company like TigerText to basically minimize the risk and secure the communications that we knew were going on. What has grown from there is really a recognition that TigerText is really not just a solution for HIPAA-compliant texting, though it does an excellent job of that. It really became a solution for improved workflow and outcomes within our hospital. It gave us a platform whereby not only the initial efforts for physician communication could be improved, streamlined, and made more efficient, but also could be a platform to grow workflows between nurses and physicians, between ancillary staff and physicians, between nursing and nursing. Really, all disciplines could have a new platform in which they could communicate. Our traditional workflow was primarily through paging, which has been around in hospitals for years, but we recognize there are certainly pitfalls with that. We mapped out this kind of spider web-like workflow to show basically what it probably looks like not only in our hospital but in hospitals across the country of what traditional communication looks like. Step one, you have a nurse that identifies the need to reach a physician and typically pages them through a paging office or operator. By step two, the physician receives the page. Not unusual, the physician is not immediately available to return the call. Either they're tied up with patient care, they're interviewing a patient, or they're in the middle of a procedure. And so they're going to be able to respond back, but it may take a good 5, 10, sometimes 15 minutes, and maybe even takes a second page, even to get them to respond the first time. So the physician calls back, and certainly if some time has elapsed, you wouldn't imagine the nurse is sitting there waiting for the physician to call back. Maybe they've moved on, they're addressing a patient need in a patient room and aren't able to return the call immediately. Time elapses again, then you've got this asynchronous kind of phone tag going back and forth where the physician and nurse are trying to communicate with each other. By step 6, finally, maybe 15 minutes into the process, the nurse and physician finally make that connection and then know how to proceed with whatever question that was involved. And this little lattice work that we've drawn up here is not unusual, and I suspect it's a replica of what communication may look like in other facilities throughout the country. So we wanted to do better. We wanted to really decrease the number of steps to go from step 1 to step 8, really put the two people that need to be in communication with each other in real time in as minimal number of steps to get to each other as possible. So next slide. So really we wanted to look at how can we accelerate that? How can we make the dots connect much more quickly and much more efficiently? So let me show you kind of what we see in terms of physician to physician, which is kind of where our first target was. We wanted to focus on those that were already communicating with each other within the hospital through their mobile devices, or were relying upon paging to communicate with each other. It was primarily with our hospitalists, our residents, and our surgeons. We focused on a group of 80 physicians and rolled out TigerText to this group to begin with. And what we saw was that they immediately gravitated towards it. A lot of the residents are very tech savvy. They tend to be of the generation which is much more comfortable with technology. And they saw the immediate enhancement of being able to communicate immediately with each other through their mobile devices. Next, we saw the use of our hospitalists. And if we can go back a slide, our hospitalists were really the next group, and they were the ones that were in good communication, constant communication with our residents, discussing plans of care, discussing teaching elements. They were anchored in the hospital, and we saw their role as paramount in terms of making sure that they were part of this implementation as well. Our surgeons were also a big piece of this as well, since they were primarily based in our hospital and were in close linkages with our residents. And so the three groups really, we saw a linkage there that made sense to connect them and discuss clinical issues in real time. And then what we did was we also recognized, there's more than just the hospital-based physicians that would benefit from this. We looked to our dermatologists And dermatology is a great example because dermatology, a lot of it is obviously based on images and pictures and being able to show what the skin looks like and to be able to get ideas and consultations. And so what we saw was an opportunity to leverage HIPAA compliant texting through TigerText with use of sharing of images through TigerText. Our dermatologists jumped on board with TigerText and signed up quickly. And what we saw was the willingness for physicians in the hospital side to send images over to the dermatologist through TigerText. And then the dermatologist would be able to convey almost a kind of a curbside consultation regarding images that they were seeing and give advice back to the physicians that were asking the question. What we've continued to expand, I've added some additional specialties that we've also onboarded. Our radiologists and our pathologists. Obviously, they're not as directly involved with direct patient care, but certainly they're the ones that are helping interpret studies, interpret films, read pathologic specimens. And what they came to me was with communication problems that they had with reaching back to the referring physicians that were sending them the slides to review or the images to review, particularly those where there were critical or time-sensitive results they needed to get back to a physician. Oftentimes, they had a hard time getting back to the ordering provider. They, maybe found an ordering provider when they were off or when they were off call, and it became quite a bit of a challenge for this group. So we said, hey, why don't we also add these groups onto TigerText as well? Since we already have the full directory of physicians on board, they were a quick add-in, and they really appreciated the fact that they could go back and send HIPAA-compliant information back to these physicians, discussing results of studies, of films, of CTs, and certainly of pathologic specimens back to the ordering providers in real time. So it's really changed how our workflows of communication are carried out in our hospital significantly. So it's not just physicians as well. It's really nurse back to physician. And if you think back to our original little kind of web of communication with the 8-step communication between a nurse and physician, it really boils down to just a step 1 and a step 2. That you've got a nurse who TigerTexts the physician through their device. And in our hospital, we've chosen to have the nurses who are already frequently in front of either a desktop or a laptop because of the use of the electronic health record. They've got a dedicated device that they're on essentially through the whole shift that they use. They can use that same device to then TigerText the physician. The physician typically then receives their messages on their mobile device and is able to, in real time, respond. And what we're seeing is, and we've tracked this type of data, we're seeing responses within seconds. I mean, what used to be minutes to, more than minutes has really boiled down to seconds. And I heard an astounding statistic. I believe it was that over 90% or 95% of TigerTexts that are sent throughout the entire TigerText, all the clients are all answered on the order of seconds, or less than 60 seconds, which is really amazing. But it really shows how robust and how real-time the communications can be. And certainly then you move on to step 3, where the nurse can then proceed on with patient care and have, oftentimes the question, it may be a few texts back and forth to clarify, to get your question completely vetted and clarified, and then you've got marching orders to proceed. And it's really what we're looking for, real-time communication. And I would add that we really needed a step like that in place. I don't know if your facilities have seen this as well, but in our facility, with the advent of the electronic health record, we see more and more of the physicians gravitating towards the little physician workrooms or to the medical library that has a bunch of computers, and less often in the patient care areas, less mingling with the physicians and nurses where they're in the exact same area providing care. So we needed to have a better communication process so that we're not losing that importance of communication between nurse and physician. And it really goes even beyond nurses, physicians, to case management. Case management was kind of our next launch in terms of our department that we thought would be most valuable in bringing on board. And so within the last several months, we've actually brought on board both bed control nurses, discharge planners, caseworkers, social workers. These are all the key clinicians that are so important in moving a patient through the hospital, understanding the discharge needs, certainly understanding the social milieu in which the patients are living in, to make sure that we do the best in terms of transitioning their care once they do depart from our hospital. Utilization review people who are kind of tracking the progress of patient care. These are all the people that we wanted to link very directly with the physicians, and again, take communications from what was traditional, being pages and waiting for callbacks, not sure if you've paged the right physician, to direct linkages between the case management folks and also with physicians. And certainly this appears to be physician-centric in communications, but this circle goes all the way around. There's a lot of intra-departmental communication that goes on, obviously, between caseworkers and social workers and discharge planners as well. But we wanted to make sure that we essentially were linking the people that needed to be in communication with each other in a most efficient manner. Next slide. Pharmacy was yet our next department that we added on, and pharmacy was a really great story. When I approached the pharmacy director about the possibility of adding on HIPAA compliant texting, he was ecstatic. He had come from a facility that had already had a solution in place, and he had been our pharmacy director for now about 2.5 years. And so when I brought this to him, he couldn't be more supportive. He brought his staff on board very quickly, and they've become probably, next to our physicians, probably the highest utilizers of TigerText. There's a lot of communications that need to go on between pharmacists and physicians, particularly in electronic health record world, where there's need to clarify orders. There's a need for physicians to seek the advice of pharmacists regarding dosing. We really wanted to, again, break down any barriers, any limitations where clinicians would be hesitant to try to make communications and clarifications. And so there's a lot of intra-departmental communication between pharmacist to pharmacist as well, and certainly from pharmacists back to physicians to say, hey, maybe you would think about maybe using a different antibiotic in this situation, or hey, this heparin drip that the patient is on, we're titrating to maybe not quite the right goal. Let's think about adjusting and augmenting. And so we see some excellent communications where, again, we're relying previously on paging and on kind of asynchronous communication. I wanted to kind of highlight a couple of the different features that are within TigerText as well that really makes it a unique solution. The ability to know, and I kind of am excerpting from the first quote in the upper left-hand corner from one of the pharmacists that gave feedback, the ability to know when your message is not only delivered, as in delivered to the person you want it to get to, but also when they've read it is so key. Because if you know they've read it, then it takes a little bit of that anxiety off you to say, okay, yes, this is an important message that got out to the person that I intended it to. They've read it. Okay, now I can kind of step back a little bit. They're probably going to get back to me in a matter of seconds to minutes, but I know that it's gotten over to them. Two, the ability also to really see efficiencies and productivity and workflow. I think you see just kind of how there's also the ability to kind of keep, quote unquote, a paper trail, or just kind of an ability to track what communications have gone out there and be able to know and validate the communications that have been done. So, next slide, please. In terms of adoption rates, we've really made a big push in October, November, where myself and others from my organization had an opportunity actually to participate in what was called Tiger Launch. It was an opportunity to meet with other organizations that are also using TigerText and hear their success stories, to hear how they had implemented and what they've done to be able to leverage use of TigerText. It was a great opportunity where we brought back a lot of ideas and a lot of energy and excitement to really kind of continue the improvement in terms of how we use TigerText. So we've seen a significant improvement in terms of not only the number of active users that are using TigerText, but also the number of messages that are sent across the channels. Our next steps are really to then go beyond the hospital. We believe that the next step will be to expand. As Mark mentioned in the very beginning, our healthcare system is not just our 2 hospitals here in Ventura County, but we have a network of roughly 30 clinics through the county, both primary care, specialty, and also behavioral health. And our desire is to roll it out to the ambulatory and specialty care clinicians as well. So they then also have that ability to do real-time communications, both with hospital-based folk, but also within their clinics as well. Next slide. So I love this slide, just the image is so apropos. So as with any change, there's always going to be pushback. There's going to be those that say, hey, you know, I like the way I'm doing things, though. It was a very easy argument to be able to say, hey, you really like paging? You really want to stay with that method? There's clearly a better way to do this. But one of the areas I wanted to specifically address was a little bit of pushback that we heard from a minority of the physician residents that said, you know what, hey, I'm in a situation where I have a very difficult schedule. You know, I work 24, sometimes 28, even 30 hours in a row, and then I've got time off. I'm post-call. I'm going to be at home. I don't want to be disturbed. I'm going to be resting. You know, I don't want to be constantly attached to my phone where someone could, you know, get a hold of me, interrupt me when it's not really my responsibility, or I've passed off or signed off duty to someone else. And certainly, we were sympathetic to that. We don't want, you know, we want the information to get into the hands of whoever's caring for the patient as quickly as possible. Obviously, you can imagine the safety implications of communications trying to get to the wrong person while the patient's there waiting for an answer, or heaven forbid, is having some time-sensitive issue that you absolutely have to get the physician involved. TigerText has a great solution for this, which is the Do Not Disturb functionality. And similar to how most mobile phones also have a Do Not Disturb, where you can kind of have it silenced for a period of time and not notify you of messages or other alerts, TigerText also has a Do Not Disturb function within its application as well. And what that does is, before I even send a message, let's say to Dr. Smith, who is maybe the resident taking care of the patient, as I pull up Dr. Smith's name in the TigerText directory, it will immediately tell me, even before I've sent a message to Dr. Smith, that Dr. Smith is on a Do Not Disturb mode. And that tells me, okay, that's Dr. Smith is probably off call or is off on vacation. And it also will then give me a heads-up message that says, hey, currently I'm off. Dr. Jones is covering for me. Please contact Dr. Jones until I return, you know, tomorrow. So that is incredibly helpful, right? So I as the person that's wanting to get a hold of Dr. Smith, knows, okay, I'm going to reach Dr. Jones instead. I don't have to waste my time sending pages to Dr. Smith and wondering, hey, why aren't my pages being responded to? Am I sending to the right person? Is Dr. Smith too busy to respond? You know, that was our workflow essentially, and we had a lot of problems where we're trying to reach the wrong physician and not getting responses. This is a so much better solution where you've got an ability to quickly alert anyone that's going to want to contact you to know who else is covering for you and who it should go to. So that to me was a big answer in terms of this pushback that we've had, and it's been working as expected, which is exactly what we wanted. Next slide. So our plan has been really to kind of take small bites as we've gone along. As you've kind of heard, we've kind of gone first primarily with the residents, surgeons, and hospitalists in the hospital, and then kind of rolled it out kind of in concentric circles beyond that, adding department by department. And really, we've been trying to get the word out through awareness. In my role as a Chief Medical Officer, I have the opportunity to address our medical staff as a whole, and I've done 2 successive quarterly staff meetings where I've brought examples of how we're using TigerText. I've encouraged the clinicians to use it. I've also brought demonstrations of actual workflows and how it can save time, and really the response has been very positive from people. As well, we've had success in terms of engaging specific key champions, both on the nursing side, on the physician side, who then really carry the message beyond what I could be carrying as well. We've had some key hospitalists who have been our greatest champions. They're the ones that are out there encouraging their residents to use TigerText. When they notice someone trying to communicate to them through paging, they say, hey, you know what, maybe in the future you could probably send that to me through TigerText. We've actually almost leverage some level of competition. As you know, physicians can be very competitive about things, and we've actually been tracking utilization and who's been sending out the most TigerText per month, and crowning our TigerText king or queen of the month. And so we've kind of made it a little bit, kind of a fun thing for people to consider as well. We've thought about how to most quickly bring on users, and that's probably what we're going to leverage when we expand out to the clinics as well. Since it's such a large number of physicians, it's impossible for me to certainly bring the message personally to each and every one of them. But we're planning to use a campaign called a fast deploy campaign, which is essentially a quick way that people can get onboarded and up to speed using TigerText from their mobile device, and not need a lot of software loading and so forth, and really target those that we know are using a lot of communication already at this point. And finally, I think one of the key things is what I've put in the lower right-hand corner about reaching your tipping point. What we've found is that the more that we have users using TigerText, we're hoping that we've reached a point where it's just the expected norm that people are using TigerText. That if you get enough people using TigerText, then other people just have to join and be on board. And we're right at that point now where the bulk of our communications are now going out through TigerText, and we feel that it's one of those where people have sensed the momentum. Those late adopters have said, you know what, I've been watching from the sideline, but I recognize that it's probably something that I need to do to stay up on the communications and be able to hear about what's going on. And so people are kind of now joining on board, and we're really capturing the people that we need to capture. So we're really excited about that. So in terms of results, in that earlier slide, we talked about how that traditional communication through paging could take upwards of 15 minutes, and that's really a conservative estimate. I mean, that's assuming you've paged the correct physician or you've paged the right pharmacist or otherwise, that you've actually located the right person, and they are really the ones that were appropriate to respond to. You can imagine if it wasn't the right physician or wasn't the right clinician, then it's going to exponentially grow that number until you've gotten the right person. We ballparked that we thought that within a 24-hour period on call, a resident on average is probably getting 8 to 10 pages just from nursing, pharmacy, and other case management staff and so forth about issues on the floor. This is not to count for physician-to-physician pages that are going on and other things that come through to them as well. And so just doing simple math, that's upwards of 2 to 3 hours spent of just handling communications, which is incredibly inefficient. Certainly their time is better spent actually providing patient care and being involved with patient care. You can imagine the number of distractions that we have, whether distracting a physician while they're in the room with a patient or they're working on a document with electronic health record. In this world of electronic health record and data and information, there's a lot of distractions, and there's a lot of data out there talking about alert fatigue. And TigerText actually helps minimize that, since you're getting your information quickly, efficiently, getting the message back out, so you're not getting constantly alerted for things and paged about things. So we really see it as a solution that will be with us to stay. And so we're excited, and I think it's great that I've had the opportunity to kind of share what we're doing out here, and I do hope to hear some questions and hear where you guys are at in terms of are you guys on the road of thinking about bringing on something like HIPAA compliant texting to your facilities, and how I can answer questions about how we have come along the journey as well. Next slide.
All right. Well, thank you, Brian, for a wonderful overview of some of the ways that you're using secure texting within your environment at Ventura County. I think there's a ton of questions coming in, and we're actually going to ask the question in a second. But I'm going to cover a couple things on secure texting and a few other use cases that I think you've covered a large number of the really interesting ones at your facility. But before we do that, we're going to pop up a poll question for our audience to get a little more kind of understanding of some of their how they're using secure texting or planning to use secure texting, or what's driving that decision-making process. So there's a poll question you'll see on your screen, which you can, our audience can select as many as apply to their specific institution, and if they've either implemented secure texting or if they're planning on doing it. But while we give our audience a second, Dr. Wong, maybe do you have any surprising benefits you realize? I know you listed some great ones from using secure texting. Anything that was surprising to you in terms of the outcomes or benefits of once you implemented secure texting at Ventura County?
Yeah, in terms of surprises, you know, I thought there honestly would be a little bit more pushback, a little more hesitation with change. We had just in July of 2013 implemented our electronic health record, and so that was already a big change, and it impacted a lot of workflows. But I honestly want to say that since the timing was very similar in terms of when we brought on board TigerText, people were used to being in front of a device. People were used to using a device much more in their day-to-day workflows, and certainly physicians in particular were not, you know, unfamiliar with mobile devices, and so it was great to see how much the medical staff really engaged and were willing to bring on a new change. And I think it's really a testament to the fact that it really is an improvement in terms of their workflows. So.
Great, thank you. So why don't we go ahead and pop up the results. Let's see what we have in terms of our survey responses. So not surprisingly, the top 1 and 2 is, in terms of reasons that's driving the implementation of secure texting, seems to be from our audience HIPAA compliance and making sure to comply with regulations and keeping PHI safe and secure, and then workflow improvement. And, you know, it's interesting. I think we see this pretty consistently, so I'm glad to see our audience is typical within the healthcare continuum of how people look at secure messaging and how it can help them organizationally, and compliance is definitely a key component. But also, as Dr. Wong was really highlighting, there's a wealth of different improvements in terms of your workflows that actually impact your bottom line in material ways, whether it's just acceleration of the communication within the continuum of care, getting patients in and out faster, just a range of different ways. Number 3, it looks like, was maintaining control over communications. I think that's a really good point. A lot within healthcare, there's been a lot of uptake of communication technologies like mobile device management and strategies to make sure to keep all these devices that have now entered the health environment or the healthcare environment, because organizations, if they're not supplying devices to their staff, people are bringing in their own devices, and BYOD is kind of taking hold. And with that has come a loss of control. So organizations are looking for ways to get that control back, and I think it's great to see that one of the ways they're looking to do that is potentially with secure texting solutions. Let's see. Also, page replacement we see, and then and these are all pretty heavy numbers, and part of a larger e-health initiative, which is great to see. So it comes along the same storyline that we're really seeing a major uptake in terms of organizations in healthcare implementing secure messaging solutions. So it's great to see this poll reflects kind of what we're seeing in the market and hear from the audience. So we're going to go to the next slide, but Dr. Wong really had some great examples. I want to cover just a couple more of ways with its organizations are improving their outcomes by using secure communications. So next slide, please. As pretty as I like that tiger. Some of the other benefits and ways that organizations are using it comes to improving staff communication. So the instantaneous nature of text messaging is one of the most important impacts of how to improve communications and have things work more quickly. This asynchronous communication versus the time it takes to pick up the phone to have a two-way conversation. When you want to get information very quickly back and forth among coworkers and care team, it's the fastest way known to do it right now is with the secure messaging solution. Confirmation receipt, I think Brian's term was anxiety reduction. I think it's just a critical point that we spend a lot of time in all of our days chasing around people trying to get information and knowing if they got it or not. So we can feel like, oh, okay, so they've got the message, they've read the message. Those two steps within a secure messaging solution like TigerText are really important to both improving the pace with this workflow happens, as well as it also improves accountability in that people are like, okay, I've received the message, everybody knows I received the message, so now I have to take action to address that message. So that's a really nice grease in the wheels, they say, of making things flow smoothly. It also helps from a group perspective where you can collaborate in a conversational mode with groups of people, an entire care team. We have a number of healthcare institutions that when they bring in a new patient, literally create a new group conversations with the care team, and we use that to just communicate throughout the continuum of care for that individual patient. So that's one way we see the advantages of secure messaging within healthcare. Next slide, please. So another way is looking at, as Brian talked about, was patient admission and discharge, and just the number of different ways the workflow slows down. You know, I have a 4.5-year-old child who just loves to get cuts and bruises and ends up in the ER. He's probably been there 10 times in the last 2 years. And the most frustrating part is some of the time it takes is actually getting discharged out of the facility we go to, our local hospital. And it's because just there's a lot of processes that require signatures and just a lot of back and forth communication that doesn't always flow smoothly. So it's great to see the impact you can have in terms of both admission and discharge within a healthcare facility, whether it's just notifying the care team, use cases such as getting messages to the treating physician when a patient's changed status or discharged, getting communication of key diagnostic images, as well as the confirmation that the paperwork is complete and the patient can actually be released. So the result is that you get people in more quickly and you get out more quickly, which has two important impacts. One, you can see more patients, so you can treat more people. And two, from a bottom line perspective, it clearly has an impact in keeping patient beds filled, as well as making sure that you're treating as many people as you can possibly do. Next slide. So from a diagnostic perspective, whether it's working at the PACS or LIMS systems, but a lot of times you have to go out for labs, and getting the lab results delivered quickly, it can be a time-consuming process. So using TigerText, you can actually snap images and share them in a HIPAA-compliant fashion to quickly get that information to the physician or the caregiver that needs it. So it's also an alternative way to help communicate with the ordering physician to get them that information, as opposed to using pagers, which can be a slower process, or the workflow might take longer just by the nature of the technology. So this is something that, you know, it helps get the information there more quickly. It also, we've seen examples within the ED department where someone will come at a patient, as an example, may have burns, and the specialist isn't either on site or is preoccupied or is at a distance away. Using TigerText, they can securely capture an image and get a quick read on, hey, this patient needs to be admitted, or here's the triage, and they can be treated locally and discharged. So just getting that information to the point of care more quickly is a huge impact in terms of delivering care effectively and efficiently. Next slide. So the same thing we talked about escalations when something happens with a patient. So making sure that you can quickly move to address or triage the situation as it occurs. The message confirmation capability in a secure messaging solution, it lets you know that the message gets delivered and action can be taken. Also, as Brian pointed out, the ability to know when people are on staff or off staff with do not disturb messages allows you to make sure that people, if someone goes off shift, that the right person gets the message, and you know that by the fact you can actually let people sleep, I think, as Brian mentioned earlier. And one of the things from a performance perspective, and this is actually funny because this exact quote that Brian mentioned earlier, is that 95% of responses we've seen when TigerText are answered in under 60 seconds. And that kind of speed of communication just leads to faster workflows and better outcomes, because you can get the information to the people who need it more quickly than you could otherwise with existing technologies or workflow processes. Care team coordination. So this came up in the questions, and I'll cover it now, but one of the ways, it's not just about TigerText as its own technology, but how it works with other technology stacks within the healthcare continuum. So clearly, the importance of TigerText integrating with other key technologies, it integrates with key EMRs such as Cerner, such as point-click care, and others, so you can get information out of those data stores and quickly utilize that to help improve treatment. Answering services and scheduling tools like Amion are also other partners of TigerText, so you can use TigerText to securely get information about things such as this picture shows someone actually checking schedules via Amion using the TigerText application. And the point of TigerText is really it's the next tool in the tool chest for communication, and it's helping the transition from older technologies or legacy solutions like pagers which are definitely on a down cycle. And even the difficulty sometimes of using email or secure emails, which can be cumbersome sometimes to use and require special logins to make work effectively, which only delays the process of communicating. And last but certainly not least, it's that two-way communication versus one-way communication and playing phone tag where you can't get to the person you're looking for. That is absolutely one of the biggest things you'll see, is that when people move to secure messaging solutions, the ability to actually get a hold of people, get the information delivered so they can use it is much faster. In group messaging, the ability to communicate with the entire staff at once as opposed to a single person-to-person communication can clearly move the process along more quickly in many instances. And last but not least, we talked about HIPAA compliance throughout today's conversation, and I think it's important to reinforce the importance of maintaining security and maintaining compliance with HIPAA, HITECH, and other standards. The security is critical. With TigerText, end-to-end encryption ensures that all the messages stay encrypted and secure, whether they're in transit or if they're at rest on the device. We've all seen, just every almost week or so, we see another healthcare institution talks about someone lost a mobile device or someone lost a computer, and it happened to have PHI on the device, and it becomes just a major black eye for the institution. It becomes a black eye for compliance. It becomes a black eye in terms of the process and procedures. And it's just something where you've got to make sure your information stays secure on the device as well as when you're using it to communicate. TigerText employs enterprise-grade security to ensure that all this information meets these standards. And one of the things we set out to do is to make sure people understood. We so-called put our money where our mouth. We have a $1 million guarantee backing the compliant nature of our application to give people the peace of mind to know that we stand behind our product in every facet to make sure they know when using TigerText you'll be HIPAA compliant for your communication practices. Next slide. And lastly, on the ROI, just one or two more data points that I think Brian really covered some of the high points, but some of the things we've seen with other clients is patient wait times dropping in half. We have one customer whose nurses see 50 more patients per shift, which is a significant impact in the amount of patients they can actually treat. This was directly due to the fact that they were able to communicate more effectively and efficiently with the doctors to get that information to them. It just reduced the amount of phone tag significantly. Another customer, 80% reduction in email and phone tag. You can see where we're going. These benefits are real. They have a real meaningful impact to organizations that are using secure communication, both for the compliance issue as one of the driving factors, but as we saw in our survey, also it's the workflow and the productivity benefits that come with using a real-time communication solution like TigerText. All right, so at this point, I think we're up to the Q&A. So I think I'm turning it back over to Akanksha, correct?
Yes, thank you, Mr. Layden and Dr. Wong, for a very informative and enjoyable presentation. We will now begin the Q&A portion of the program. As a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A, and will follow up on questions they do not have the opportunity to address. Okay, so our first question, I will direct this to you, Dr. Wong. Does Ventura County Medical Center deploy TigerText on employees and physicians' personal smartphones?
That's a great question. Yeah, some organizations have chosen to provide devices for their physicians and employees. In our role, what we've done is we've done kind of two-part strategy. So for our physicians, they do provide their own devices. Since they were already bringing their devices and using them, we thought that it would be duplicative to issue a separate device and have them carry around two devices. So our physicians use their own device. For the staff, meaning the nurses and the pharmacists, the case managers, they all use county-issued or hospital-issued devices, primarily laptops, desktops, for what they communicate with.
Wonderful, thank you. Our next question, are messages audited and archived for possible legal needs?
Actually, I'll answer what I know of that, and then I'll defer some of that to Mark as well. But actually, intentionally for security reasons, these are not archived. And actually, when you send a message, you can actually determine the length or the lifespan of that message. It can be as short as less than a day or even on the order of hours, up to, I believe, about 5 to 10 days. And then what happens after that point is that the message is completely wiped, erased from all devices, meaning if I sent it, it's deleted off of my device and also the recipient's device, and potentially anyone else that they have forwarded that message along to as well. What we would do practically, though, is if there are communications that need to be archived for medical legal purposes, we would go through a separate workflow to do so. But traditional messages would not be archived. Mark, do you have anything to add to that as well?
Yeah, just to add on to that, I think that was a great overview. So the message lifespan is a key component of the TigerText solution in that you can set, or the organization can define for all of their constituents, how long messages are available. Up to 30 days is the longest length, but the organization can set a policy for exactly what they'd like, so it is specific to them. As it relates to archive and retention, it's organization specific, so we have the capability for organizations to archive their message if, as a policy, they decide they want to do that. But we find that institutions make that decision, and there's best practices. I think there's no defined one way to do it in this area, but we provide the capability to do it either way.
Wonderful, thank you. Our next question is also directed toward Dr. Wong. Did you see a difference in the way hospitalists use secure messaging in comparison with other doctors? Were there any more complaints or pushback?
From the hospitalists specifically? No, actually, if anything, they were the ones, along with our residents, that were probably our quickest adopters, excuse me. Our physician champions and the ones that have been crowned king and queen of TigerText have actually been hospitalists. And they, if anything, are the ones that are communicating with a lot of different folks, between consultants, between residents. If anything, what we noticed was that it was actually our hospitalists were the ones that were helping me identify those that we had missed as well. Because they would say to me, hey, Dr. Wong, we noticed that there's a couple of paneled pulmonologists that we missed in our initial rollout. Let's make sure to add them because we've talked it up to them and they want to be a part of it. Or hey, we've got this linkage with our sister hospital, and there's a bunch of them out there that, though they're in a smaller unit and smaller operations, they would like to be a part of it as well, because there is some communication that goes back and forth between the two facilities. So if anything, our hospitalist group has been some of our best allies in terms of driving it and then helping me identify who else that we've missed. As a completely side note, what we've noticed also is not only within our agency, but we've had some of our community partners, some of the IPAs, some of the other facilities that we link up with, they've also asked us about TigerText as well. Since we've been using it, they've been wondering about how they can also bring on compliance solutions for their internal communications, but also communications to our system as well.
Wonderful, thank you. And do you use texting for physicians' orders? And if so, how do you accomplish the read-back patient safety process?
Yeah, that's an excellent question, and that really is a policy-driven thing. We as an organization have stated that we do not allow texting of orders over TigerText, mainly because of compliance reasons and just kind of our comfort level and risk. So we've actually chosen not to do it in that fashion. If there is an order that needs to be communicated, what we've asked is that that go through a traditional method. So for instance, if I was in a TigerText communication with a nurse and I came to the point where I said, you know what, I need to order a specific medication, what that would look like would be, I'd be like, nurse, is there a number I can call you at, and literally pick up the phone, call them at the nursing station, and then telephone in the order once they are able to get in front of the electronic health record, have them pick up, log in, get into the electronic health record, verify the order, get that read back to me, validate it on both sides, and then we go from there. So that's an excellent question, and really that's kind of the standards and the kind of best practices that we've heard from other organizations as well, and so we're in line with that.
Wonderful, thank you. And our next question, how does TigerText integrate with an existing mobile device management policy or bring your own device policy?
Good question.
Yeah, I'm sorry.
No, please, go ahead, Dr. Wong.
Okay. I'm sorry, I think I cut you off. Was there another part to the question, or?
Let me just repeat that for you guys. How does TigerText integrate with an existing mobile device management policy or a bring your own device policy?
Okay, good question. That may be one that I would defer a little bit to my CIO in terms of the specific policies surrounding mobile device management. What we've seen is that what we've asked for our physicians and driven into policy is two-part. There's the importance of making sure that your own mobile device that you've brought in is secure and is locked. So all devices that are brought on campus from a personal location are required to be secured. And then you can secondarily secure as a agency-wide, you can require PIN and an ID to be entered as you enter the TigerText application as well. We thought that would be unnecessary since we've had the first step secured. And that's kind of one of the mitigation strategies that we've put into place. Mark, are you aware of other things that other organizations have done as well?
So let me add maybe, Dr. Wong, from a different perspective, since you cover the policy-based issues in terms of how you handle mobile devices. I think the flip side is I think the technology the questioner is asking about in terms of the other, there's a number of different mobile device solutions. We work with examples like Mobile Iron and others who have a large presence in healthcare because the policy issues are relatively significant, and making sure that organizations are able to control the security of the devices within that environment, I think, is critical. So as an application, you tie into that directly, so we're part of their ecosystem, so that we can get the same type of federated privileges that can be controlled from an MDM solution. I think I would add on this, because integration seems to come up, and we've seen a few more questions on this, is integration with other application stacks. And I think it goes back to the slide we talked about earlier, but we find it's important to be part of the ecosystem and integrate with the different components, whether it's MDM players, whether it's EHRs or EMRs, just to make sure that we're facilitating the communication within the healthcare environment so that you don't end up with, so as an EHR is a good example. You may have an EHR that's a great information data store, but it's not necessarily a great mobile communication application. So what we do is we facilitate integrations with some of the leaders like, as we mentioned, Cerner, PCC, and others, through TigerText, so you can get that information out, easily access it, even sometimes from the EHR itself, and use TigerText to ensure the security of the communication of the information to facilitate that workflow and process within the healthcare institution. So I think it's an important part of any secure messaging solution is to understand how they integrate, who they integrate with, and whether it integrates with the applications you use within your environment.
Wonderful, thank you. For our next question, Mark, I think I'll direct this one to you. What, if any, are the implications related to Stark Law with the hospital providing this for physicians?
I have to be perfectly honest. I am not 100% sure I know about the Stark Law. Maybe, Brian, are you familiar with it?
Sure, I can help with that. Stark Law is basically regulations around the fact that you can't self-refer, so it has to do with how for instance, hospitals cannot directly employ physicians where there is potential for kickback, for provision of services and so forth. I'm kind of thinking as I'm speaking, and I'm not aware of any implications or risks regarding Stark Law violations in this, and certainly this was something that was vetted through our legal and county counsel as well when we went this direction. But maybe if the person that posed the question could expand on that a little bit further and kind of bring to light what risks they were thinking in mind, we could address that a little bit further.
Okay, we will move on to the next question for now. Does TigerText have voice recognition capability?
So from a technical perspective, we ride on the device's voice recognition in terms of, like, if you were talking about speech to text. We don't do order entry into a system per se using speech recognition, but we utilize the resonant technology. So on an iPhone, you're probably familiar with that. You'll see the little microphone, and so a lot of times people use that to send messages. But we don't strictly try to be an expert in voice recognition technology because the hardware manufacturer typically is the expert at that, and so we defer to the device's voice recognition capabilities.
Okay, great, thanks. Our next question, does TigerText receive or send to unsecured devices?
That's a great question. Actually, Brian had mentioned this earlier about how they use fast deploy. So when an individual hasn't deployed TigerText, the application, on their device, we can still send them a secure message. And what we do is we send them a secure link via the traditional SMS channel, so that you actually can send a link to someone that says, click here for a secure message from Dr. Brian Wong. They'll click the link. It'll open up into a secure browser session on their device, and literally you can have the same level of security and encryption that you would on a TigerText app conversation. And in fact, it looks just like TigerText. So you have the ability to actually do that, to reach out to people that aren't actually using the application or haven't installed it yet. So you can send it to devices that haven't actually installed TigerText.
Wonderful, thank you. How does TigerText impact the user's monthly data usage or this type of plan on their mobile device?
Yeah. Mark, can I take that one? Because I actually thought of that was an exact question when we faced some of the pushback. That was actually the exact question that some of our residents had posed. They said to me, well, I don't want to be using up my data plan. I'm worried about battery usage. I'm worried basically it's going to take over my phone and make it inoperable. And I know that TigerText they actually have a white paper on specifically the amount of power usage and so forth. But because we have a Wi-Fi network throughout our system and throughout our facilities, essentially all of the devices they bring your own devices are on the Wi-Fi, and so they do not incur any data usage for that. Additionally, the amount of power used is almost minimal. And Mark, I think you may know some of the specific numbers, but I remember seeing at Tiger Launch a presentation of the amount of battery usage, and it was almost insignificant.
Yeah, I don't have, so I appreciate you bringing that up. It's a great topic, and the studies we've done have shown it's just a negligible event. One of the interesting things we just released a brand new refactored application on our platform, and one of the things we did as part of that process is we implemented something that's called a low connectivity protocol. And that had two really interesting effects that are relevant to this conversation. The first one is that because of the sophistication of our application and how it uses a low connectivity protocol, the application TigerText sips bandwidth versus gulps it. And what that does in terms of reliability is amazing. So you get in situations where you've got a poor cell connection or you're too far away from the Wi-Fi hotspot, and most other applications or messaging applications that gulp will fail because they won't be able to get out because the bandwidth requirement is too heavy. So it does two things. First, it increases the reliability, but when it comes to battery usage and drain, it significantly reduces both the data packet size, so it reduces the amount of bandwidth you're using, and it reduces the amount of battery drain. But it's a negligible event, and I will, if anybody's interested, I'll be happy to share with them the analysis we did on that specifically.
Hey, Mark, I'll just share one more thing, and just anecdotal from our facility, and I pose that we have a Wi-Fi network within our facilities, and I know that that's not true of all facilities, but what we found was that in certain parts of our hospital, classically the lower floors, the basement area, that people were having problems with cellular coverage in those areas, but were still getting their TigerText because they were up on the Wi-Fi network, and so it actually gave us a better solution in those particular locations where physicians were sometimes missing phone calls or certainly not able to place phone calls, but were receiving their Wi-Fi TigerText.
Wonderful, thank you. And I think we have time for one last question. How do you trigger messages when a patient gets admitted or discharged?
How do I trigger messages when a patient gets admitted or discharged? And I think that what it sounds like is where you had an integrated or interface solution with your electronic health record. That's not something that we've launched yet in terms of our facility, but I imagine what that might look like would be, for instance, you could leverage your electronic health record both, for instance, upon admission order or upon a completion of an H&P document or a discharge summary. You could set up an interface where that would then set up a secure message that goes out to the primary care physician, alerting them of an admission and with a link to, for instance, the document itself or an ability to pick up the document through other channels. But I could see that as a real nice interface that you could set up to enhance the PCP communication in those fashions.
All right, thank you so much. And I want to thank, again, our presenters for their excellent presentation and for all of you for participating today. We look forward to having you join us for future webinars. This concludes today's program. Have a wonderful afternoon.